My name is Kim Hutton, and the topic I chose to present on is decreased levels of physical activity in children. My reasoning for choosing this topic is that I have 2 young children of my own, and we're out and about and we see children that are sitting in the park on their cell phones or in a rec center playing in the video gaming room instead of being active. I hope to implement a healthy lifestyle for my children, and I wanted to look more into this trend of decreased activity. So, I will be talking about the causes for the decreased activity in children. I will go over childhood obesity slightly because as much as it does have to do with physical activity, there's also a whole nother part, which is your nutrition factor. I'm going to talk about some other factors related to physical activity and prevention and intervention. So what can we do to change this trend? First of all, a quick quiz. You can answer the questions in your head, write them down, participate how you choose, and at the end I will go over the answers. So name one reason that children are less active now. How much has childhood obesity increased in the US since 1980? What is one acute illness related to childhood obesity? According to the American Physical Therapy Association, what is the main cause for sports injury in children? And what is an ideal place to implement change? Barriers to physical activity. I already touched on it a little bit, and that's technology. It's not just my personal opinion that technology has changed the way that our children play. A study at the University of Washington took a group of children and watched their use of technology. So 66% of the children under 5 had 4.1 hours of screen time in a day. That number increased to 10.75 hours when these in the adolescent range. 10.75 is a lot for one day, but it also included the multitasking time. So that's having dinner with your cell phone next to you, playing games when you're supposed to be doing your homework, or multitasking and doing your homework at the same time. So it's not just straight focus time on that piece of technology, but multitasking, multimedia time. Other factors involved: socioeconomic, so your child's safety. A lot of parents have seen injuries happen at the park. Little Joey fell off the monkey bars and broke his collarbone. Well, I'm not going to let my child go to the park anymore because those equipment items are unsafe. Is that the better way of doing things? Would you rather your child sitting on the couch? Other child safety factors could be: what neighborhood do you live in? Is there a park close by? Can the parent go to the park with the child? Or if there's crime in the area, is there parent supervision so that children are not in danger? Financial constraints. That's going to include whether parents can pay for the organized sports, and parent participation. So not only paying for the sports, but are they going to attend the sports? And a study showed that children's participation in an event directly correlated with the parent participation, and that's going to include verbal encouragement, cheering them on at the sidelines, attending the event. Childhood obesity. Obesity, according to Lakshman, Elks, and Ong, is the excess body fat that increases the risk for morbidity and or premature mortality. Morality. Sorry. Obesity has almost tripled in the US since 1980. And this is a worldwide trend. It's not just in North America. There's countries like Ukraine, Bosnia, and Albania that's also affecting them. An increase in obesity levels have been observed in children as young as preschool aged. So this isn't something that children are taking years to become obese. they are becoming obese in their youngest years, which means that they are going to be prone to illness at a younger age as well. Because obesity leads to acute illness in childhood as well as long-term health problems as they age. Some of the acute illnesses would be type 2 diabetes, asthma, musculoskeletal problems. It's going to include hypertension and mental or psychological disorders as well. Long-term health problems are going to be, cardiac heart failure because their heart is not strong enough to support the weight that person holds. It's a stress on your bones, on your muscles. So they're going to have, again, musculoskeletal or mobility issues, as well as early death. Other factors related to physical activity. The American Physical Therapy Association concluded that poor physical conditioning is the main cause of sports injury in children. Children benefit from resistance training the same way that adults do. So your bone health. Resistance training is going to increase your bone density, or the child's bone density, as well as their muscular strength and endurance. Mental health. You're going to reduce that child's stress, increase their energy and concentration. You're going to help them at school. And sleep. It was found that children that had less sleep or went to bed later at night were more sedentary. They're sedentary at night in those hours before they go to bed, and they're sedentary the next day because they don't have the energy to participate in physical activity. Prevention and intervention. Where? Schools. Schools have the most contact with children, the most consistent time with them, and the most intense time with them. This would be the perfect place to implement change. How? The activities that are being introduced to children must be entertaining. They must be exciting and involve the children. And you need adult support. Children do not naturally know what is good for them. They have to be taught that. And then they have to be given the opportunity or given the ability to use those skills that they're being taught. Take 10 is a program that's been implemented across the world. I'll show you a map in a minute, but it is bringing physical activity to hundreds of schools into the classroom. It's providing activities that get the children out of their desks and studying math on their feet by doing jumping jacks for addition, or backwards lunges for subtraction. It has been shown to increase achievement scores as well as improve their academic performance, and it reduces the sedentary behavior in the classroom. So this is the map I was talking about. The blue areas are going to be those areas that Take 10 is already in place. So USA, Chile, Brazil, Indonesia, China, UK, and then there's a couple green areas that Take 10 is hoping to take their program, and that is Mexico, Colombia, and Guinea. My Take 10 exercise for you to participate in is about food superpowers. So the objective of this one is to help students identify the 5 food groups and their health benefits. I'm first going to go through the food groups and their corresponding activity, and you are going to stand up and participate with me. So grains. For grains, you're going to run in place for 10 seconds. Grains provide carbohydrates, which produce energy, and fiber that helps with digestion. Dairy, you're going to do 10 lunges because you have strong bones from the calcium that is provided by milk and other dairy products. Vegetables, 10 jumps for joy. Vegetables provide vitamins and minerals that offer us healthy eyes, skin, digestion, and prevent many diseases. Fruit, you're gonna do 10 boxing punches, and this is because fruit helps you fight disease. And protein, 10 bicep curls, because protein, meat and beans, etc., help us build strong muscles. So as a review, grains run in place for 10 seconds, dairy 10 lunges, vegetables 10 jumps for joy, fruit 10 boxing punches, and protein 10 bicep curls. So now I'm going to take that screen away and I'm going to ask you or tell you 3 different health benefits, and you have to do their corresponding activity. So number 1, this provides calcium for strong bones and teeth. Do the corresponding activity for that food group. Calcium is dairy, and that's going to be 10 lunges. This food group provides 80% water, and that's fruit, so you would be doing 10 boxing punches. And this food group helps you build muscle, and that's bicep curls for protein, 10 bicep curls. So a teacher would go on and continue in that way, or they could also say a food, so pineapple, and the child would have to do their 10 boxing punches for pineapple while they themselves list off the health benefits. So there's different levels, different ways to run this activity. In conclusion, I'll give you my quiz answers. So number 1 was, what is one reason that children are less active today? And that could be technology, parent participation, financial constraint, or safety. Obesity has tripled in the US since 1980. Number 3 was asking for one acute illness related to obesity in children, and that would be type 2 diabetes, asthma, musculoskeletal problems, hypertension, and psychological disorders. Number 4, according to American Physical Therapy Association, the one thing that the main cause for sports injury is poor physical conditioning. And the last question is, where can we implement change the best? And that's going to be in your schools, because you have the most contact with children at school, and you can also reach the most children as long as they are participating in school and not homeschooled. So overall, physical activity is a huge part in children's health. It's changed a lot in the last 40 years at least, when, obesity has tripled in the USA in 40 years. And not quite 40, I'm rushing us. By far, physical activity is not the only thing that needs to be addressed, but nutrition is a whole nother presentation, and I hope you enjoyed this one. Thanks for listening.